I think after that patriotic talk, I'm going to talk about a legal talk. So, adolescent is a bridge between childhood and adulthood, and it is full of curiosity, changes, and sometimes risks also. In India, we have two realities. One is POXO Act, and another is right to safe abortion. But when these two meet, confusion takes over. Misunderstanding the law can lead to adolescent deprive their safe and effective treatment timely and could push them towards unsafe abortion and lifelong complications. We must talk about this because silence is unsafe. So today we talk about these realities. We understand the law, we understand the medical realities, and most important is we understand the rights and dignity of an adolescent. So, starting with the POXO Act exists primarily to protect children under 18 years from sexual assault, sexual harassment, and child pornography. The POXO Act defines a child as any person below the age of 18 years. The Act incorporates child-friendly mechanism for reporting, recording of evidence, and investigation, as well as speedy trial of offences through designated special courts. All the POXO cases should be settled within 1 year of their happening. The act is gender neutral. Pressure is not on the child to prove that the crime took place. It places the onus on the accused to prove the innocence. Consent is key. Any sexual activity with a person, that is irrespective of the gender, below the age of 18 years is considered a crime under POXO regardless of consent. Whether it is a consensual sex or non-consensual sex, it is a crime. The offense is more aggravated when the abused child is mentally ill or the offense is committed by a person who is in position of trust or authority, like a family member, police officer, teacher, or a doctor. It is the duty of every citizen to make to report a suspected child sexual abuse to local police station, to special juvenile police unit, childline helpline at 1098. He may be or she may be a teacher, a police officer, a hostel warden, a doctor, or any other responsible citizen of India. Like if I see a patient, if I see a child in my OPD just for a vaginal discharge, then it is my duty that if I suspect any sexual abuse in that child, I have to report to the above said persons. And if I fail to do so, I may be punished for 6 months imprisonment and or a fine. So it is a very important point for all the doctors, police officers, teachers to know that they have to mandatorily report any even suspected child sexual abuse. Now, once the news is there or that there has been a incident like this, the confidentiality of the child particulars has to be maintained. Media has to secure the identity and privacy of the child. Disclosing or publishing the identity of the child victim, like name, address, neighborhood, where she lives, or school name and other particulars, is punishable with imprisonment again for not less than 6 months, but can be extendable to 1 year or with fine or with both. So government is very, very particular about non-disclosure of the identity of the child. Severe punishments are there as far as POXO Act is concerned. If the punishments are more severe, if the child is less than 12 years of age, or if it is a gang rape, or offenders between 15 or 18 years of age, means the accused, if the age of even accused is of 15 to 18 years, along with sending them to juvenile court, they get the same punishment as adults also. So this is just a small table about what are the punishments, though we don't remember it. But The assault can be a penetrative assault or can be a sexual simple assault. Penetrative sexual assault, it can be an imprisonment between 10 years to life and a fine. Penetrating sexual assault child below the age of 16 years, imprisonment between 20 years and life imprisonment and a fine. And aggravated penetrating assault may lead to even death penalty. Sexual assault, minimum 3 years imprisonment, and aggravated sexual assault can lead up to 5 to 7 years of imprisonment. So these are the different hard punishments for this thing. My message to all the doctors is that pregnant minor girls, may be married or unmarried, is considered a victim of sexual assault. So if any patient in antenatal comes to you who is less than 18 years of age, she is MLC has to be made in that case, because she is considered as a victim of sexual assault. Under POXO Act, minor girl is unable to consent to sexual intercourse. We have to make MLC in all the cases, report to appropriate authorities and take the receiving. If knowingly fails to make this report, can be punished, as I discussed in mandatory reporting. Don't insist to file FIR. There is a difference between MLC and FIR. This is very important to know. MLC is our duty, that we inform the concerned authorities who are responsible to convey it further to the police about the case happening, but FIR is not our responsibility. If patient refuses to do the FIR or patient refuses to inform the police, we can just take it in writing. And once we have done MLC, it becomes the police personnel duty to talk with the relatives for the further action. So please make a MLC, but don't insist on FIR if if the child is refusing or her parents are refusing. Rape is an indication for termination of pregnancy. Protocols for MTP are to be followed, like consent of guardian is a must, because before the age of 18 years, no child can give consent for any surgical procedure. Ask police to collect DNA kit from forensic lab and bring it to the hospital at the time of MTP, so that we can use this DNA kit to collect blood sample of survivor. Fill the form, paste a photograph of the survivor, so that this DNA testing can be used at the time of identifying the accused and in establishing the paternity. Products of conception must be rinsed with normal saline and collected in a wide mouth container with lid, and it handed over to police to be transported in ice box at 4 degrees Celsius. So these were the few medical legal points as far as POXO was concerned. I have just taken into a very short, because revision is required. There are detailed films on POXO Act and details lectures, but this was just a short recapitulation. Now, talking about safe abortion. So, safe abortion, I would also like to name it as safe and legal abortion. So, access to safe and legal abortion is an essential part of sexual and reproductive health services. What is safe abortion? So, as per WHO, termination of pregnancy using methods recommended by WHO and performed by trained healthcare providers in a hygienic environment is a safe abortion. It ensures minimal risk of complication and is crucial for women's health and well-being. Now, what is safe abortion or legal abortion as per Government of India? Termination of pregnancy within specified gestational limits, performance by qualified medical professionals, ensuring access to safe and hygienic facilities, and documentation. Provision of comprehensive abortion care with a woman-centered approach is the main guideline issued by Government of India. So this is comprehensive abortion care, and the training for comprehensive abortion care are given at many centers all over India. Now, coming to the first point, who can do the MTP? RMP whose name has been entered in a state medical register. RMP is a person who is MBBS. So an MBBS person can do MTP after specified training. Now, the type of training required and the duration of training required depends upon the duration of pregnancy for which termination is going to be done. So if MTP is only up to 9 weeks and is being done by medical method only, then one has to have experience of at least 3 months at any hospital in obs and gynae department, or has independently performed 10 cases of MTP by MMA under the supervision of another RMP. So 10 cases of MTP by MMA under supervision, or 3 months training in a hospital established or maintained by the government or government approved training center. Now comes the MTP up to 12 weeks. Now I would like to clear that Government of India approves medical method of termination only up to 9 weeks, and from 9 to 12 weeks the preference is given to the medical method. But after 12 weeks, Government of India does not approve medical methods for termination of pregnancy. So only up to 12 weeks, mainly up to 9 weeks, but 9 to 12 weeks is a borderline time where we can use medical methods along with surgical method. But after 12 weeks, they surely say that in India, Government of India, we do not approve. Of course, other this thing like WHO and RCOG guidelines are there for termination by medical method after 12 weeks of pregnancy. So a person who can do a MTP up to 12 weeks is who has assisted 25 cases of MTP, out of which at least 5 has been done independently in a hospital established by established or maintained by government. MTP up to and beyond 24 weeks, 1 year experience in obs and gynae, or 6 months house job in obs and gynae can be done by a RMP also. A doctor with a PG degree or diploma can do MTP of any gestational age. As far as opinion is concerned, MTP up to 20 weeks, 1 RMP opinion. MTP between 20 and 24 weeks, not less than 2 doctors' opinion, and beyond 24 weeks, medical board decision is required. After 24 weeks, 2 RMP should perform the MTP. So up to 24 weeks, 1 RMP can perform the MTP, but opinion of 2 RMP is required. But after 24 weeks, 2 RMP should perform the MTP. So again, coming to the medical board, members are gynecologist, pediatrician, radiologist, and any other members as notified by the government, and function is 2 functions made. To allow or deny MTP beyond 24 weeks of gestation after examining the woman and her reports. Means 2 things are to be seen, that whether woman is eligible or competent enough, means comfortable enough to undergo the MTP, along with the condition of the fetus, that fetal malformation is of such a substantial risk that it is he or she is going to be incompatible with life, or if the child is born, it may suffer from severe physical and mental abnormalities. It is very important, as I said, ensuring that the procedure would be safe for women at the period of gestation. So 2 points are to be seen by the medical board. A medical board has to provide opinion whether they are rejecting or giving approval for this MTP within 3 days of receiving the request for MTP, and to ensure that the MTP, when advised by the medical board, is carried out with all safety precautions along with appropriate counseling within 5 days of the receipt of the request, is also the duty of the medical board. Medical board can co-opt other specialists also. So now indications, we all know them, but it is just a revision that up to 20 weeks, to save the life of the pregnant woman, to prevent grave injury to the physical and mental health of the woman, in view of the substantial risk of the child, pregnancy is caused by rape, and failure of contraceptive device or methods, this all are applicable up to 20 weeks. From 20 to 24 weeks, again, survivor of sexual assault or rape, minor, change of marital status during the ongoing pregnancy. That means either there is widowhood during pregnancy or there is a divorce. Women with physical disabilities, women including mental retardation. Fetal malformation that has substantial risk of being incompatible with life, or if the child is born may suffer from abnormalities. Women with pregnancy in humanitarian settings or disaster, like कहीं पे भूकंप आया कुछ आया, out of that emergency she was raped or the pregnancy has occurred, so from there 20 to 24 weeks abortion can be taken into consideration. And beyond 24 weeks, it's only one and the one indication which can be taken by the medical board, that is for fetal malformation only. There is no gestational upper limit provided the medical board gives the permission. However, if beyond 24 weeks and not other than fetal malformation, somebody wants MTP out of rape that exceeds 24 weeks, the only recourse remains through a writ petition. Means court can only order after 24 weeks in an indication other than fetal malformation. Till there is a fetal malformation which is not competent with life, a medical board can give the decision. But if it is not because of fetal malformation, only court can give the order or permission to give get the termination of pregnancy done. Place, we all know, hospital established or maintained by the government, no separate registration. If it is being done in Maya Hospital, ESI Hospital or GTB Hospital, no separate registrations needed. In a primary health center, up to 8 weeks, community health center, up to 12 weeks, district hospital, up to 20 weeks, and in a medical college, any period of gestation that is up to 24 weeks and beyond. Private health facility which are approved by the government, that is district level committee approval should be there. For MTP up to 9 weeks, the MMA drugs can be prescribed by an RMP at his or her clinic, provided such an RMP has access to a place which is approved for MTP and should display a certificate to this effect from the owner of the approved place. So they need not to take any permission, but to display a certificate from the owner that they are linked with us, and in case of emergency, they can bring their termination of pregnancy patient to our clinic, and we will give the due care to the patient. And fourth, so who, when, where. The fourth comes the documentation. Documentation means recording and reporting about the MTP, means proper record maintenance. So mandatory, it is mandatory to fill the information in following forms. Consent form, that is form C. RMP opinion form is form 1. RMP opinion form which has come new. This is newly, it has come into this thing after the amendment, that 20 to 24 weeks of period of gestation, form E is to be filled. At a medical board, more than 24 weeks of period of gestation, form D has to be filled. Form 2 is monthly reporting form. So one is recording, another is reporting. So form 2 is monthly reporting form to be sent to the district authorities, and form 3 is admission register for the case records of MTP. So this is new form, that is form E, MTP between 20 to 24 weeks. Consent form is now, these all are to be kept into an envelope, that is RMP opinion form if it is less than 20 weeks, form 1, RMP opinion form 22 to 24 weeks, form E, and medical board opinion form D, and form 2 monthly reporting form and admission register for case records. They all have to be kept in an envelope, in a sealed envelope. So this is the format of admission register. Now comes the main point, that what are the offenses and punishments if the MTP is not performed properly or not as per the rules. So contravened means that it is not as per the rules. So it is a cognizable offense, that is arrest without warrant. If you have done a MTP at a wrong place by a wrong person, or there is a death of the patient during MTP with the wrong procedure, then there is arrest without warrant. It is non-bailable. That means serious offense, and bail is a matter of discretion. Bailable means that you have a right to get bail, but it is not bailable. And here, a non-compoundable ki jagah, it is, I just forgot to delete non, it is reverse. It is a compoundable offense. That means parties cannot compromise. पार्टीज कैनॉट कॉम्प्रोमाइज. ऐसा नहीं हो सकता कि उसने कहा कि कोई बात नहीं, मेरी एमटीपी हो गई, गलत हो गई, पर अब मैं कॉम्प्रोमाइज करता हूँ. नो, once the matter has come into the knowledge of police or the court, there cannot be any compromise outside the court. So it is a compoundable offense. In non-compoundable offense means complainant can agree to take back the charges levied against the accused. Now, what are the punishment for the breaking the rules of MTP? That is termination of pregnancy by unauthorized person, rigorous imprisonment for 2 to 7 years, persons performing MTP, MTP in an approved place, rigorous imprisonment for 2 to 7 years. उसमें दोनों implicate होंगे, owner and persons performing the MTP, and failure to document, record keeping, consent, admission register, etc., fined up to 1,000 rupees and 1 year imprisonment of the concerned person. So these all have to kept in a envelope. So till this point, I have discussed the two main important, that is the POCSO Act and the rules for the safe abortion or legal abortion. Now, these are certain points. Out of these three, they come for the knowledge of adolescent also. But now, once the adolescent has suffered the trauma of sexual abuse, how she should behave and how we should console her. We have to tell her that it is not your fault. It is not, onus is not on you to prove that crime has occurred. We have to teach our adolescent and children that your body belongs to you. No one has the right to touch your private parts without your permission, or make you touch their part without your permission. They cannot ask you to touch their parts also. This includes known people, relatives, or strangers. Private parts are private. What are the private parts? Your body parts covered by underwear, swimsuit are private parts. The adolescent has to decide who touches you and how the touch feels. It's okay to say no loudly and clearly, even to adults or older kids, if you feel that the touch is wrong. Understanding your body and safety. Good touch versus bad touch. Good touch means touch on your touch which you feel safe by the loved ones, and it is a comfortable touch. Bad touch means you feel scared, confused, uncomfortable, or secretive. That means touching your private parts or forced kisses. Your body, your rule. You can say, don't touch my body, don't touch me. So one has to make the adolescent understand that their body, and they can deal with their body according to their permission. Good secrets are fun surprises. Bad secrets make you feel scared or uncomfortable and often involve threats. Don't tell to anybody. If I've done this much to you, please don't go and don't tell anybody. So you have to learn to differentiate between good secrets and bad secrets. Never keep a bad secret about touching. Go and tell a trusted adult immediately. Now, who is this trusted adult? The trusted adult is when an adolescent finds out 3 to 5 adults or knows 3 to 5 adults whom she or he absolutely trusts. These can be their parents, their aunt, their uncle, their teacher, school counselor, or even a doctor. So they can count them as their trusted adults. And as you know, when I was talking about POCSO, that the assault is aggravated if it is done by the trusted adult. So Very important point is the trusted adult. If the child trusts in an adult and that trusted adult performs abuse, then it is an aggravated abuse. Oh, feeling, you should know that the something feels weird, scary, or wrong in your tummy. Listen to that feeling. Get away and tell your trusted adult. Online safety is the real safety. Don't post your photographs online. Never share pictures of your private parts or yourself without clothes with anyone online, no matter who they say they are. Never meet someone you only know online without trusted adult present with you. Pregnancy happens, they should be told that how the pregnancy happens and how to protect from this pregnancy. So it starts when a sperm meets an egg and this requires a sexual intercourse. Second risk of these risky behavior is, first is pregnancy, second is STI. So STIs are the germs you don't want to have in your body because they can cause sickness and they can be spread through sexual contact. STIs are not just from sex. So these are all points I am telling for the adolescent who are sharing our webinar, and for us also to tell our adolescents that you need not to fear and you have to understand the following points. STIs are not just from sex. While often spread sexually, some STIs can also spread through infected blood, like sharing needles, or from mother to baby during birth or breastfeeding. The symptoms of these STIs can be sneaky or absent. Many STIs show no signs at first to know you have one. So pregnancy, now the impact of these risks, these behaviors are very drastic. Pregnancy requires a huge responsibility. So one can't dream of having pregnancy in early age of life, and STIs can cause pain, infertility, serious illness, or even death if untreated. So we have to understand the risk. We have to make our adolescents to understand the risk. We have to make them learn, grow, and play. Pregnancy and STIs are major roadblocks for their future and for their growth. Knowledge is power. We have to make them learn about their body and how the body behaves in a healthy way. Boundaries are brave. Practice saying no or stop. I don't like that firmly if someone is crossing the boundaries or touching your body. Get away. And if such thing happens, get away and tell. If someone tries to touch you inappropriately, get away to a safe place immediately and tell a trusted adult right away about what has happened with you. Safe adults don't ask for secrets. A safe adult will never ask you to keep secrets about touching or make you feel uncomfortable. You should know how about your body and you should do your little things yourself. But you are old enough to wash your own private parts, so don't take help or don't let anyone to make you take bath. Respect other boundaries. Never touch someone else if they don't want you to touch. Focus on health. Eat well, exercise well, get enough sleep. Education is your superpower. Open doors to careers, independence, and achieve your dreams. Dream big, focus on the steps to get there and how to fulfill your big dream. Economic independence is freedom. School is the first step for being able to earn money and build the life you want. Delay sexual activity. The absolutely safest way to avoid pregnancy and STI as teenager is not to have sex. So just say no to sex. You have your whole life ahead for relationship when you are older, mature, and ready for it. Future protection when older. When you decide to be sexually active, the only way to prevent STIs is using condoms correctly every time. You should see a doctor if you have any problem. You can talk to them privately about your health, including your sexual health. It's not your fault. Never blame yourself. Tell immediately to your trusted person. And if something grave happens to you, like a sexual assault. If the first adult doesn't listen to you to or your story, then tell another, go to another one and keep telling until someone comes forward to help you. Don't wash or change your clothes if abuse has happened. If possible, keep clothes as they are, as they might be a source of evidence. A doctor can check you, keep you healthy and safe, and collect evidence needed. So go to a doctor and take a medical help. You can also take a police help. The police can protect you through POXO laws and designed to help you in a faster way. Counseling is your strength. Go to your counseling and feel better. Why we are talking all this on the eve of Independence Day? Because true freedom is in being safe in your own body, free from harm and fear. We have to learn. We have to have the freedom to learn and grow. Have the freedom to focus on school, hobbies, and building your skills. Everyone should have freedom to choose one's future. So freedom to choose your future. So this is the connection with Independence Day. Greatest gift you can give to yourself is stay safe and healthy now. Protect your freedom to choose your career, relationship, and life path when you are ready. I think you must be, by the time you must have gathered that last slides are made by Madam Shada Jain for the adolescents to make them away from the risky behavior. Thanks a lot. Thanks a lot.